Hi, Dr. Russ here. In a previous video, we worked on Brance's right hip and calf, and now we're going to do a little work on his middle back, neck, and shoulder. I hope you enjoy the video. As always, I like to warm up with some nice skin level, movement, and looking here at a little asymmetry with his left lower rib cage being a little more prominent. We've been working together for quite some time, so I'm pretty familiar with Brance's structure. That's not unusual for him. So I'm really looking more for areas of focal tension where the superficial fascia may be feeling restricted or hung up somewhere. And definitely always interested in rib and scapular mobility. And there's a nice little trigger point here, lower trapezius. Brance, can you hold your arm out to the side? Yep. And so in that light, you can really see the outline of his lower trapezius muscle right there, and then the middle, and then the upper is here. Go ahead and let your arm rest again. So where I'm really focusing is this border between the lower trapezius and the latissimus dorsi. And those are thoracic erectors. Good. So I like to do a little rocking on folks when they're on the table, just ever so slightly, because it gives me a chance to really feel how their body is responding to movement. Good. We're going to follow that lower trap all the way up to its attachment on the spine of the scapula right there. And that all feels pretty good. Which brings us to the rhomboid. So the rhomboid is going to attach from here to here and then come up to the cervicothoracic junction. And Brance's feels pretty smooth, so that's good. Now looking at infraspinatus, teres major and teres minor. In that lower scapula right here, we can pick up a trigger point. So as I am feeling for trigger points, I usually want to feel across the fiber orientation, because then those little knots really become pretty evident to your finger, like little BBs under the skin. And that's what we're looking for. And here's one. Pretty big, actually. Maybe more the size of a cashew in his teres major. And that let go really nicely right there. So we're thinking about the lower trap and the rhomboid and how they overlie and blend with those infraspinatus muscles. The infraspinatus, teres minor, teres major, and then the lat. So let's do some lat work next on this right shoulder. So we're looking at a little lat work. Got one hand on the front side of the lat, inside the axilla or the armpit, and the other hand is going to roll over that muscle. This whole thing here is the body of the latissimus. And don't forget, the latissimus starts all the way down here on the iliac crest. So it's really all of this. But we already covered this part. And this is the part where it really tends to have trouble and create pain in the lower scapula, in the middle thoracic, or sometimes the shoulder. Because when it's tight, its action is to pull that shoulder blade forward and down. So you can see here, I've got this big belly of the muscle, and the reason why it has trouble here is because it actually twists on itself before it attaches to the humerus. So there's a lot of strain on that muscle, not just along the fibers, but also rotationally. And that can create localized tension, which will inhibit microcirculation, and that's how trigger points form. So I'm really creating pressure on the muscle between my fingers, maintaining that pressure, and rolling out. So I'm cross-frictioning, but not repeatedly, not aggressively, pretty gently, because it's tender. I've got my fingers in his armpit, and there it is right there. And we just saw a nice little bit of relaxation through the scapula, and he's doing great. Good. So let's see where we are with the shoulder. Always interested in abduction of the shoulder, and we want to see nice rotation of his scapula here, which we do. Here's the inferior angle of his scapula right here, and as I abduct his arm, it translates out and forward, and that's what we want. I'm always wanting to see good movement of the scapula on the rib cage like that, as well as good movement of the head of the humerus in the glenoid, so that's the ball and the ball and socket of the shoulder. The other part that we're going to look at on the shoulder is the clavicle, and we'll do that with him lying on his side or lying face up. So let's start by looking at the neck and just seeing if anything in there wants to be mobilized, adjusted. France is in really good shape, so I wouldn't be surprised if there was nothing. But yeah, here's something right there, upper left. So this is C3, and this is asking us to just a very gentle lift on the left side. You ready? Mm-hmm. Nice deep breath in and breathe out. No, that's not going to go. Let's try the other way. So on this side, I want to give it a little lift with my left hand and a little forward thrust with my right. Nice deep breath. Good. That's it. Much easier. Okay. To finish up, we want to look at clavicular movement. And it feels like the right side is moving really nicely, and the left side is just a little sticky. Here's where the clavicle meets the sternum right here. So what I want to look at, as usual, is shoulder abduction, and we really want to see a nice movement between the clavicle and the sternum right here. And it's a little stuck. So a little bit of oil so we can glide on the skin, and as always, doing a little gentle prep work, skin level, just easily opening up the pectoral muscle a little bit and mobilizing the skin, and right there is where we can feel. Actually, it feels like the clavicle and the first rib right here where they meet. That's where the restriction is. So this is tender on people. We don't want to press too hard, but we do want to try and get a little bit of movement right there. You okay, Brance? Mm-hmm. Okay, good. So again, abducting the arm, and I'm going to try to induce actually a depression of the front of his first rib and get a little separation from his clavicle right there. Good. Leading us all the way down the pectoral. Let your elbow go. Now I feel like that's moving the way it's supposed to move. Getting a little separation between the clavicle and the first rib when we abduct his shoulder. Good. So we covered a lot of ground from the hamstring through the middle back, the neck, and both shoulders, particularly the left. And we'll call that good.